Well, nurses in England, Wales and Northern Ireland are striking today in the largest action of its kind in the history of the National Health Service.
In yesterday's PMQ, Sir Keir Starmer told Rishi Sunak it was a badge of shame for the government and accused the Prime Minister of being in hibernation instead of working to call off the strike.
The Royal College of Nursing says staff have been given no choice after the government said the 19% pay rise demand was simply unaffordable.
Well, we can speak now to Maria Caulfield, the Under-Secretary for Health and Social Care, who joins us this morning from Westminster. Good morning to you. Look, we've just been reviewing the papers. I just want to show you the front of the Mirror. We are with you, the headline. Perhaps you might expect that from a left-leaning paper, but the headline for the Express, normally very loyal to the government, coming out with "Give nurses a deal and stop this madness." Have you lost public support on this?
Well, I think it is very disappointing to see strike action in 44 of the 215 trusts in England. Health has devolved matters, so as you said, the Welsh Government are also seeing strike action in all but one trust in Wales, and in Northern Ireland the government there are seeing strike action in all of these trusts. So whichever government is empowering those devolved nations, it is disappointing to see strike action today. It will mean around the cancellation around 70,000 operations, outpatients appointments and procedures, and that's not where we want to be.
Poll in the Daily Express, Minister, says 52% of people support the strike, 27% oppose it. That's huge. You have really lost, as Isabel said, the public on this one.
Well, we have got a difficult choice as a government. The RCN are asking for a 19% pay rise. That's a £10 billion of funding that we would have to find to be able to pay for that. And as a government, we've only got three mechanisms to do that. It's not the government's money, it's the taxpayers' money. And we would either have to borrow to pay for that, and we all saw a few weeks ago what happens when governments can't afford to borrow money in terms of the impact it has on markets and interest rates. We either then tax people, and I think no one would want that at a time when people are already struggling with cost of living pressures, or we take it from existing services, and that would mean taking it from NHS budgets where we're trying to get through COVID backlogs. We're in the middle of winter pressures, and when we're opening up new surgical hubs, new diagnostic centres, new hospitals, that would make taking money from those projects. So we have a very difficult decision. A 19% pay rise is just not affordable.
Negotiate down from 19% quite clearly. 7% was what they landed on, with 9% for those on the lowest pay grade. If Steve Barclay had actually agreed to sit down with Pat Cullen and discuss pay, perhaps he would have found that out.
Well, Steve Barclay did meet with Pat
Yes,
Cullen,
he did, but he wouldn't talk about pay
week.
specifically, which seems ridiculous during a pay negotiation.
Well, we have been pretty clear, and the Prime Minister was extremely clear yesterday. There's an independent pay review process that comes to decide where pay lands. We're not saying that nurses don't deserve a pay rise. That's why we gave 3% last year when no one else got a pay rise. The independent pay review body have recommended 4.5%, but for the lowest nurses it's over 9%, which we accepted in full. And so, you know, if you're going to have an independent pay review body that looks at things like inflation, staffing levels, retention issues, and negotiate that with the unions as well, then, you know, we have to respect that decision, and we have accepted it in full, as did the Labour government in Wales, as did the government in Northern Ireland as well.